In this next section, now we will discuss some clinical signs of infections, classification of a wound infection, and some other clinical features associated with the infection of the burn wounds. You can see here the clinical manifestation: margin of erythema, margin of redness is very common. Erythema is the redness. So there is margin of erythema present in the burn patient. Frequently surround site of burn. So the margin of erythema is frequently surround the area which has burn. Not usually indicative of infection. So redness, erythema, or margin surrounding the burn area usually is present, and it's not the indication that the infection of the burn wound is present. It's not the indication. So it's just the margin of redness surrounding the burn area. Some signs of infection: we have a conversion of partial thickness to full thickness burn. So sometimes partial thickness burn can progress to the full thickness burn. Full thickness burn, partial thickness burn, there are 3 layers of the skin. We have subcutaneous tissue, and then epidermis, dermis, and subcutaneous tissue, which is the fatty layer, 3rd layer of the skin. So in full thickness burn, all these 3 layers are affected: epidermis, dermis, and subcutaneous. And in partial thickness, usually it's just the epidermis or dermis is affected. So full thickness, all 3 layers of the skin are affected in that. Color change. Color change: dark brown or black discoloration. So initially it's the erythema or redness. Slowly it becomes black or brown, and it causes the color change. New appearance of erythema or violaceous edema in normal tissue. Sudden separation of eschar from subcutaneous tissue. So the eschar tissue or the dead tissue, as a result of the burn, it separates from the normal, from the subcutaneous tissue. Degeneration of wound with appearance of new eschar. So these are some signs of infection. It can change from partial thickness to full thickness. Color change to black or brown. There is again new appearance of erythema or violaceous edema, and then a sudden separation of eschar tissue from subcutaneous tissue, and degeneration of the wound with appearance of new eschar. Now classification, early surgical excision of devitalized tissue. So surgical debridement or surgical excision of the devitalized tissue. Burn wound infections are classified into different types based on that excision. So burn wound infections classified in relation to excision site. Can be burn wound impetigo, which is loss of epithelium from re-epithelialized surface, allowed to close by secondary intention, grafted burn, or healed skin donor site. Burn-related surgical wound infection, purulent infection of excised burn and donor sites not epithelialized, positive culture. So depending on the excision site, the burn wounds can be classified into burn wound impetigo, burn-related surgical wound infections, and then also burn wound infections like burn wound cellulitis. Cellulitis is extension of infection to surrounding healthy tissue. Once the cellulitis occur and the spread of infection to the surrounding areas, usually it's not a good prognostic factor. Prognosis is not good once the cellulitis or septicemia develop in the burn patient. It means the infection is now spreading to the surrounding tissue and ultimately it's spread to the bloodstream. Invasive infection in unexcised burn wounds. Infection secondary to partial or full thickness burn wounds. Separation of eschar or by violaceous discoloration of eschar. Green discoloration of wound or subcutaneous fat. And development of ecthyma gangrenosa. So all these are different classification of the burn wound infections. Burn wound cellulitis if it spread to the surrounding area. Invasive infections of the unexcised burn wound, which is not excised or excision is not occurred, debridement is not done. Infection usually is secondary to partial or full thickness burn wounds, separation of eschar or violaceous discoloration of eschar, green discoloration of wound or subcutaneous fat, development of ecthyma gangrenosa. Some clinical manifestations are the changes in body temperature. That's an important clinical manifestation, the change of the body temperature. Hypotension, tachycardia, blood pressure is low, there is fast heartbeat, and these are all the changes occurring slowly when the infection is spreading to the surrounding area. When the cellulitis, septicemia is developing, usually patients have hypotension, tachycardia, body temperature changes. Altered mentation, neutropenia or neutrophilia, thrombocytopenia, renal failure, sepsis, profound alteration in homeostasis. So all these are the clinical manifestation. Homeostasis is to keep the body in balance. So when all these changes are occurring, or when when there is septicemia or cellulitis developing, the homeostasis is affected. The ability of the body to keep the body in balance is also affected or is altered. Alteration in the body temperature contribute to thermoregulatory dysfunction. Tachycardia and hyperventilation accompany metabolic changes. Changes induced by extensive burn injury, not necessarily indicated of bacterial sepsis. So this is as a result of thermoregulatory dysfunction. We have changes in the temperature. There is tachycardia, hyperventilation, and this might be not an indication that the septicemia is developing. It's only because of the dysfunction of the temperature regulation mechanism. So that concludes the section 2. Thank you for watching sqadia.com.